Thanks so much, and thank you for having us. It's a great honor to be here, and thanks so much for the hosts. I will be presenting on behalf of our team at UNAIDS and all the countries who collect the data to be able to produce the estimates on global HIV and pediatrics. Next slide, please. So I would like to acknowledge our lead and someone you are used to seeing every year at this conference, Dr. Mary Mahi, our team lead, and she's now the director for data department. And again, I would like to acknowledge all of our country teams who collect and produce this data. As you know, last week, on July 13th, we have launched our new global update 2023, which provides the latest data on the global HIV response and more on infants, children, adolescents, and women. You could have seen the launch of that report. We have amazing products online where you can have a look at the most recent data and the key messages across the populations of interest. We would like to emphasize that the depth and breadth of this year's report reflect the contribution of hundreds of people from national government, civil society, and partners, researchers, staff at UNAIDS, and co-sponsors, all the partners who are involved in the global AIDS response. That's a massive work that we are proud to be producing every year. One of our key messages is that the programs for preventing the transmission of HIV during pregnancy, birth, and breastfeeding have averted more than 3 million infections in children since 2000. And those are direct infections that's been averted since 2000. It is still, our estimates show that 1.5 million of children less than 15 years old were living with HIV in 2022. Most affected regions are Western and Central Africa and Eastern and Southern Africa. 130,000 new infections occurred in 2022. Again, Eastern and Southern Africa and Western and Central Africa are the most affected regions. Currently, around the world, a child dies from AIDS-related causes every 6 minutes. 84,000 children died from AIDS in 2022. We see from our data, and that's not news, and we've been discussing with Mary just before the launch of this report and the presentation, that we keep saying that annual numbers of new infections have fallen, but that decline has almost stalled. We can see that there has been still 130 new infections, and this is the lowest number since 1980s. However, this still happens, and something has to be done about it. Reviving the earlier momentum requires an understanding of why so many children are still acquiring HIV around the world. The new data shows us which countries are most affected. Those are not new countries. We showed this slide from year to year. Almost 50% of new infections in 2022 occurred in Mozambique, South Africa, Democratic Republic of the Congo, etc. You can see on this pie chart. And this is where our efforts need to be focused on. Targeted efforts are needed to reduce vertical transmission across different types of stages in pregnancy, delivery, and postpartum. we can see that overarching reason that that coverage of antiretroviral therapy among pregnant and breastfeeding women living with HIV has leveled off at a little bit over 80%. This means that about 220,000 pregnant breastfeeding women living with HIV were receiving antiretroviral therapy in 2022. We can see that from those stacked bar analysis that is informed by countries who have the estimates, that mothers did not receive antiretroviral therapy during pregnancy and breastfeeding, or did not continue antiretroviral therapy during pregnancy and breastfeeding. In red, you can see the estimates which show that mothers acquired HIV during pregnancy and breastfeeding in numbers. And again, Eastern and Southern Africa and Western and Central Africa, where the estimates are one of the best and high quality estimates across the world in HIV and pediatrics. You can see the distribution of the causes of vertical transmission, but also in numbers and how many infections occur for different reasons that are outlined in here. We also have this kind of estimates for every of those affected countries, except for Nigeria this year. Last year we didn't have Mozambique, but this year we are happy to present some data on Mozambique, and we will remain available for any follow-up questions and analytics that may be required for specific programmatic decisions. The cascade of care. Again, this year we don't have better news than in the previous years. Only 57% of children living with HIV received antiretroviral therapy, compared with 77% of adults living with HIV. You can see adults in this cascade are presented in red. So this shows us that we are well short of the global targets of 95% of coverage among children. Together with UNICEF, we produced this analysis of early infant diagnosis within the first 2 months of life. We could see that, again, for children living with HIV, the treatment gaps are still wide, and one of the reasons is that early infant diagnosis is not available, especially in Western and Central Africa, and unfortunately our data shows that early infant diagnosis coverage was declining, especially in West and Central Africa. The global numbers are presented in orange and the blue in East and Southern Africa. And my apologies if I'm focusing predominantly on the negative messages. As you know, our report is split in two. We have much to celebrate, especially in Eastern and Southern Africa. And I will try to show also some examples of those positive messages in my slides. But we have to also acknowledge the gaps and what is not working. So this is the analysis that is presented in HIV and Children fact sheet, and that those are new products that we've developed this year, and I will provide the links to those products on my last slide. We have some key messages within those fact sheets. And so one of those is that the new infections among children have declined rapidly in Eastern and Southern Africa, and we present the data on that, but not quickly enough in Western and Central Africa. This is the bluish sort of line graph at the bottom of the screen. So something to think about. And the good message that I wanted to show during this meeting and also in our fact sheets is that some high burden countries have reduced vertical transmission but by more than 70% since 2010. And this includes Zimbabwe and South Africa. And we find this fascinating specifically for the reason that such a huge decline occurs in high-burden settings. And this just shows that the programs can work where the leadership is present. And we need to learn from those countries on how to implement the programs in other settings to achieve this kind of results. You can see remaining countries have less declines. Remaining countries are shown at the bottom of the graph, and the global decline is 58% from 2010. And the bubbles on the right present estimated number of children living with HIV in 2022. So you can see the burden of HIV in children across those countries. We unfortunately could not present Nigeria this year. And this is one of the 12 countries that we are focusing on at the global level with the alliance that it was launched, and I'm sure the colleagues will be speaking to that. We are focusing on 12 countries with highest burden of HIV in children, with highest number of new infections in children. And you can see that even though we are looking for the gaps, we are looking for the missing children and the programmatic approaches and how to reach them. At the same time, we would like to celebrate some progress that's been done in those countries. So our conclusion for this year's report is that we need to focus our effort, and we need to present a stronger commitment to address unequal HIV service access and outcomes experienced by children. It will take significant shifts in service delivery and the creation of a more supportive environment to recover the earlier momentum. Even though we do have reasons to celebrate in some countries, we still need to focus on addressing the gap in testing, in the knowledge of status, testing of children, making sure that mothers are tested and on treatment throughout pregnancy, delivery, and breastfeeding. We need to make sure that integrated antenatal and postnatal care and HIV services are in place. They are more affordable and convenient, especially for adolescent girls and women who are stigmatized and marginalized, and who require parental consent, to need to address the age of consent in adolescents to access services. Programs need to become smarter in finding missing women who are living with HIV but not receiving antiretroviral therapy, and this applies also to their babies. Leadership isn't limited to writing checks, and I'm adding this as a part of my final remarks, that discrimination, human rights, and issues related to stigma are all barriers that keep people living with HIV from accessing the vital resources. They need to live healthy and productive lives, the mothers and their babies, and much work still needs to be done. And I'm happy to be here presenting this update and listening to and learning from you, being able to bring this back to the global level, but also to countries, and share how we can jointly tackle this issue. I also am presenting some products that we've developed for this year's update, where you can find the data. We had many requests in the last several weeks preparing the speakers for the conference on pediatric, but also for International AIDS Society scientific conference. And depending on the analytics that is to be presented, we've looked at our data in so many different ways, and we try to pull in the key messages in those products that I'm presenting here. It's difficult to cover all the data and messages that we have right now. So we are happy to discuss offline. And thank you so much for having us here. It's a great honor presenting here today. Thank you so much.